techniques a little bit faster. So I showed you two different things, technically four different things. There's concentric strengthening of the hip and knee extensors. There's eccentric strengthening of the hip flexors. Extensors and extensors. So there's concentric and eccentric for both sides of the joint. How do we want you to do it on the practical? I'm going to make it up every single time. It's going to be different. So what are your goals clinically? Is the goal, again, if this was maybe not necessarily with the hip and knee, maybe there's a reason to do it. But maybe, like we talked about, there was like that tendinous injury and I want to just do the eccentric for her extensors. How am I going to approach this in my setup? Hand placement on the correct side of the joint is always the first thing I'm going to think about. So if we're talking about strengthening her hip extensors, where do my hands need to be?
Back of the thigh.
Posterior thigh, bottom of the foot. Now we said we want to isolate hip extension strengthening. So where in the range should she be?
Strengthening hip extension?
We're strengthening hip extension eccentrically. We know my hands are going to be here. Do I want her to be here or here?
There.
So if we are focusing on an eccentric strengthening, you always want them to be at the end range of the muscle group that you are doing the strengthening on. Make sense? If you are doing a concentric strengthening, you want them to be in the opposite. Make sense? So as I'm approaching, am I doing concentric or eccentric? That's going to be the way we do it. So if I was doing eccentric only, I'm going to hit all my points with setup, breathing, instruction, but I'm going to get my hands here and I'm going to have her at end range extension. And then patient, you are going to slow me down. Very good. Making me work for it. I get my workout today. This is why I like teaching this class too. Okay. But we may not ask you to do just one of the motions isolated. Maybe we want you to do it, okay, strengthen the hip extensors concentrically and eccentrically. We said concentrically first, so where am I going to start my patient?
Hip
Full hip and knee flexion. So we're strengthening extensors, we're going to fully flex. I'm going to have her here, and then patient, you're going to extend your hip and knee. I thought you were stronger than that. You getting tired?
I was making sure you're not tired.
And then she's going to slow me down, and we're going to do this for one. So notice the difference of body. I turned my elbow out a little bit, and then I won. My elbow was a little bit this way, and I had a harder time. So I know I showed some of you like with the hip flexion and extension, if you're here versus actually here, if you're not feeling like you're getting the contraction. So go ahead and flex. So if I'm here versus here, it's going to feel a little bit different. So remember, line of force should always be following the elbow whenever possible. This one's hard because especially if you're smaller and your patients have big legs, it's going to be harder for you to do it. So really locking in your setup, getting comfortable with being in a wider stance will be important.
One thing I want you guys to note, Dr. Parker's hand when he was doing the hip extensors is on the posterior thigh, not on the calf. His hand was kind of in that karate chop position.
Yeah, so I'm here.
A lot of you pushing on that posterior calf.
So I'm pressing this way,
but it's on the distal.
not here. I'm also not here. I'm not here. All of these things cause weird shoulder positions. Even this might feel a little weird on the shoulder. But this is going to allow me to get out of the way at the bottom. I saw some people trying to be flat and it gets weird. So generally, very rarely people have a different hand contact than this for the thigh. But now if we want to do concentric strengthening of the hip flexors and extensors, what is that going to look like? Yeah, I'm gonna have to switch my hand placement at the end. And if we're strengthening our hip flexors concentrically first, what position do I need her to be in?
This one.
I need her to be in hip flexion?
No.
Be in
This position here. That's beautiful. It worked out great for me. So I'm going to be here first. I'm going to take her out slightly to try and elicit that stretch reflex. I'm not going to do it through the knee because it's hard to have her knee slightly flexed here. But I am going to give her a little quick stretch on the hip and then go ahead and pushing to be patient. All the way, all the way.
Pay attention to
More,
the
more,
quick
more.
stretch. I saw a lot of you trying to like pull them.
And then from here, I'm switching my hands. And now you're going to extend.
That's concentric. So that's
So that is
concentric for
concentric, or that's just concentric strengthening for hip flexors,
and extenders.
knee flexors, and then hip extensors, knee extensors.
So you did the concentric for hip extension. Would that be considered the beginning range if it's in hip flexion?
So we did concentric hip flexion first. So we started here. She concentrically moved through hip flexion, and then I changed my hand contact to concentrically strengthen hip extension. Why might I want to do this pattern, strengthening both sides of the joint? I think I'm hearing stay something. What was it? Even if you're wrong, no mumble, be confident.
Strong and wrong.
Say what you just.
So you're working the quads on one end, and then you're working the hamstrings on the other, or you're working the extensors, the glutes, versus the flexors at the psoas. So I think you're just trying to balance the two.
Stability.
Yeah, so maybe the goal isn't I'm targeting one muscle group because there was an injury there. Maybe the goal of this exercise is to equal out the strengthening, provide stability. Maybe I want to have a slight more focus on muscular endurance. So if I'm just strengthening one side of the muscle and that one's gonna fatigue out faster. So I could do clinically, I could do concentric, and then eccentric. So I'm strengthening both ranges, but then that's allowing the muscle groups to work in alternating patterns so they can work longer. Or it could be for providing stability. Sometimes we'll do like isometric patterns where you're pressing in different directions for stability. That's going to be more stuff you learn in the neuro classes. We're looking at more the strengthening component, and now that gets into like sets and reps. So again, if we're focusing on strengthening, how many sets and reps am I thinking about?
Like 8 to 12.
8 to 12, 3 sets of 10, that's generally like your strengthening range. What about muscular endurance?
6 to 8.
Very good. Starting out at 3 is fine, but you're going to work into doing more sets. What if you're working on power?
6 to 8.
3 to 5 reps, 1 to 5.
Somewhere in that. So for this class, your coursework has a chart. Become familiar with that chart for your written exams to get your specific numbers. That's your general range. What else do you need if you're really focusing on power beyond just your sets and reps?
The repetition max.
Someone who's confident.
Time.
Time.
I thought he said I.
Yeah, I you said I am, and then you pointed at him. So what do you mean by time?
Like how fast you
Hours.
achieve the movement.
Like power is a function of not just how much work you do, but the speed at which you
The
do
speed of which you do it. So time is close, but if we're specific, it's the speed of the contraction. So faster contractions for power, generally less reps. But again, working with athletes, you could be doing a lot of reps at a high speed and you're focusing on muscular endurance and power. You want them to be able to produce that power output for longer. So clinically, like, great, we have a chart, that's your general, guidelines, but there are plenty of times you're working with a very weak patient that doesn't have a lot of endurance, and you're doing, 3 to 5 reps, and that is just a strengthening thing. There's times you're doing 8 reps, and that's going to improve their muscular endurance because their baseline is so low. So remember the chart, that's generally how you approach things, but especially as PTs as opposed to certified strength and conditioning stuff, we're working with a much broader population unless you are a sports-specific PT, which a lot of you will find maybe you wanted to do it coming into school, but generally, unless you're like top of the line, you're not getting paid as much and you're working a lot of hours. So, okay, so does that all make sense as far as what we can ask you to do on the practical, as far as doing concentric both sides of the joint? We can isolate just concentric one direction where you're passively moving them back the other way. Do you guys want to practice those concepts with this technique a little bit more, or should we move on to isolated? We can learn that new technique and then we can apply those concepts to both of these? Okay, very good. Dr. Leonard, you have a new therapist. I quit.
So we're gonna do